All right, so obviously this is the Disability Industrial Complex session put on today by the New Brunswick Coalition of Persons with Disabilities. So your presenters today are myself, Shelley Petit, the chairperson, and
Murielle. I'm the founder of NBCPD and head of communications.
okay. Just so that people have an idea what we're talking about, we're just going to talk quickly who we are, what the industrial complex is and its definition, a few other forms of industrial collectives or complexes, how the disability industrial complex applies to your life, a few concrete examples of the complex, two main questions to always keep in mind, and a few failures that are brought to you, compliments of the DIC, and then hoping to have some discussion with folks about it. Murielle.
So, who is the NBCPD? We were formed in the year 2020. We were founded by and for persons with disabilities. We maintain today a board that is consistently compromised of a minimum of 80% of this community, closer to 100% most of the time. It is a true nonpartisan grassroots organization. We are all volunteers and we operate like this by choice so that the ties to the government could not silence us. We emerge with one singular objective to realize an inclusive New Brunswick where individuals with disabilities enjoy improved living standards, access to appropriate assistance, and full and equitable participation in society. Why are we needed now more than ever? The most recent Stats Canada disability results show, show why the disability industrial complex is front and center in our minds. In Canada, the disability rate went up to 27%, and in New Brunswick, we went up to 35.3%. So we are the second most uh, elevated disability rate in Canada, following Nova Scotia. So, what is the disability industrial complex? What is that? We are going to test your knowledge today. Put your thinking caps on.
Oops. And at this point, I'm going to do a quick stop share here, stop sharing quickly. And for anyone that's here, we're going to put a little poll it's up now. And it's just, do you know what the disability industrial complex is? And you can just answer yes, no. I've heard that term, but I'm not sure what it is. And we'll just see what we can get for some answers. We'll just give it a second here.
Yeah, and if you can't find the polls, you can just go to the polls beside the chat option by the right, and you would find it there.
Oh, we're pretty even on the yes, more no's than yeses, but a few I've heard of it, but I'm not sure what it is. And we'll just give it another second and see. There's no wrong answers. You don't have to take this test home to get assigned by mom or dad. Any of that fun stuff. So we're pretty close. So, about a quarter of you that are here said yes, you know what it is, or you've heard the term and you feel somewhat familiar with it. About 50% said no, and then another quarter said, well, I've heard the term, but I'm not 100% sure what it means. And that's pretty accurate for what we hear in society as well. So you guys are right on the ball. And yeah, Bob has diabetes. That's where he is in the math test there. Let's see. Oops, what did I do wrong here? I did something wrong. Just 1 second. Sorry, folks. Share screen. Window. Oh, there we go. Is this what I want here, I think? Nope, that's not it either. One moment. Just
Technology is our friend until it isn't.
Yeah. So much learning to do.
Oh, yes. All the time.
Okay. Sorry, guys. Since Murielle, since Shelley stepped out for a bit, hopefully she joins us soon.
Probably not on purpose.
But the polls are still live. You could just, if you're just coming in, you can,
Yeah.
uh,
It's,
put your inputs in the polls and let's see what you think. So, do you know about the Disability Industrial Complex, or have you heard of it before? Do you know what it is, or do you have absolutely no idea?
we'd like to see in the comment section people saying what they think it is. For those who said, like, especially those who said, well, I think I may.
Yeah, like if you know what it is, what is it?
Yeah. What do you think it is?
And if you don't know, what do you think it is,
It's,
right, Murielle?
what's that?
Like if you don't know what it is, what do you think it is?
Yeah, yes. It's a term that we've, I think, all heard at some point or another. Maybe for the disability industrial complex, maybe for military or medical. It's
Yeah.
there are more than one form of it, which is also in our presentation, which
Okay.
I have lost with Shelley. Oops, she's calling me on Messenger.
Okay. Hello, everyone. For those that are just joining in, for the session today, we have a Mentimeter link to put in your thoughts about the session. It's completely anonymous, so just feel free to go to the link and put in your thoughts on the session, after the session, during the session, anytime. It will be saved and used for good purpose, I promise.
Shelley is apparently waiting to be let in.
I think she has a different, yes, please. Let me see. Just give me 1 second.
Hi there.
Oh yeah, Edward is here.
Yeah. Is Shelley on here already?
No, she hasn't joined yet.
Get in.
Can you
You're not.
request for her to come back to this session through her link?
Did you try? Are you still there, Shelley? Oh, I'm just talking to my phone.
We need to get in contact with her and get her back onto this link.
Sorry, Edward. What did you say? To contact her, and
In,
I
in her in her calendar invite, she should be able to find the location. Just enter through that
your
link, and then she'll be
calendar
back here.
advice to go to the location through there.
Here's a link.
She says she's coming.
No problem.
Edward, would there be a recording for this session?
Yes, there will be a recording as well, but
Okay.
don't worry, we'll wait for Shelley to arrive.
I'm here.
Awesome.
My cat jumped off the screen.
That's fine. That's fine. You're here with us now. You guys can begin your session.
Okay.
Murielle,
Thank you, Edward.
You're welcome.
What?
Murielle,
Yes.
you have your phone still on, I think. That's why I can hear it.
Welcome back, Shelley.
Everything okay now?
No, it's echoey.
Oh,
Oh,
okay.
I know why. There, is that better?
Yes.
All right, perfect. All right. Hopefully not everyone took off on us. I'm sorry, folks.
No, we have more votes in the polls now.
They're very patient. They're all still there.
Yes. Thank you, everyone.
All right. So we're going to continue on. So we've gotten our answer about the DIC through the poll, what people think that the disability industrial complex is. We've got quite a few. We've got more no's than yes, but we've got a few yeses and a few I've heard what it is, but I'm not sure. And then in the chat,
I've asked people to tell us.
If you think you know what it is, if you want to add it to the chat, but if not, that's okay, because we're going to explain it now. And we're going to.
If you want to share your video as well, you can just share your video and.
Yeah, I'm going to come to my screen here
and see your faces, and you can let us know what you think.
Here we go. Well, we'll move on to this because then we're going to ask you to do some more sharing with us after. Is my PowerPoint shown again properly?
Yes, it is.
Excellent.
Okay.
That's a start. So the disability industrial complex. Murielle, you were doing this one, I believe.
Sure. So the term disability industrial complex refers to a system where various entities such as corporations, government agencies, nonprofit organizations, and even healthcare providers operate in ways that perpetuate and benefit from the marginalization and exploitation of people with disabilities. I had gone over it a tiny bit while Shelley was away. Next slide.
Okay. So within, and that's a pretty big, blunt definition, but if we boil it right down, within the disability industrial collective, what it means is that more often than not, and this is going to sound negative, but it's not intentional, okay? More often than not, these groups are more interested in self-preservation as an organization than necessarily improving everything for our community. So within Canada, which is where we are, the government programs that work with people with disabilities are divvied up between the provinces and or territorial governments and the government of Canada. The provinces take on or have been given responsibility for a fair chunk based off how our constitution was created. So income supports like social assistance are done by the provinces and territories. In New Brunswick, we're number one for the lowest rate across Canada. A person with a disability is going to receive a maximum of about $8.70 a month to try and live off of. It may be cheaper to live in New Brunswick than some provinces, but it's not that cheap. Our counterpart across the bridges in PEI get double that amount. And only 30% of those with a disability in New Brunswick who are on assistance actually qualify for the disability benefit. The rest are lumped in with regular assistance. Things like disability support, whether it's your age, your devices, wheelchairs, CPAP machines, anything along that line, are provided through the province. And again, that is not easy to get. Education. So your ability to go to school when you have a disability, that is through the government. Housing. We currently have a massive waiting list in New Brunswick. We have 10,000 people plus on a wait list for housing out of a population of about 870,000. That's a big list. And the government provides 30 new portable rent subsidies a year. So if you need a rent sub, and you're just getting on the list right now, good news, it's only 315 years till you'll get one. No problem. Healthcare is provided through the province. And again, it's how do you get that accessible healthcare when you have a disability? When you go to a hospital and there's stairs at the front, it makes it hard sometimes. Accessibility and employment legislation. We have a new program set up in New Brunswick that is supposed to be there to help people get a job. The name is very similar to the needle exchange through the AIDS program. So people confuse the two sometimes. They've been in existence for a little over a year now, and they are finally going to hire a couple of employment officers. So that's moving really slow and doesn't show us a commitment to trying to get people with disabilities to work in this province, as well as training and employment reach. A lot of that is in conjunction with the federal government. So as we're saying, a lot of these provisions create more barriers than solutions right now. And we're going to change that. Because if there's one thing that people with disabilities know how to do, it's how to think outside the box. We're really good at that. We've had no choice. As I was researching to put this together, I love learning new things. I came across Kathy Snow, and if you're not familiar with her work, I really recommend taking a look at her website. Her book is called Disability is Natural. And it's who we are. It's part of what it is. And she talks about the Disability Industrial Complex, or the DIC. And she says parents and people with disabilities, again, always with the best of intentions, step into the jaws of the service system and unintentionally relinquish their autonomy, free will, and choice, and accept the notion that others know best, because for so long we were told others know what's best. Many able-bodied people that still run these DICs and government groups think that they know what's best. And that's really where the nothing about us without us slogan came from, because we know what's best for us. Each person with a disability, you can line up 100 people side by side with the same disability, and what each person's needs are, they're going to be a little different, because we are all different. We are human beings. We're not robots. Another part from Kathy Snow, and again, I don't want to say that bowl-a-thons are always a bad thing, but she talks about the concept of bowl-a-thons, right? And she talks about the sport du jour for people with disabilities. The bowl-a-thons are still happening from Padunk to Cucamonga. Organizations which claim to represent the interests of children and adults with disabilities are often, they create, promote, operate, and or fund services and activities that perpetuate this presumed incompetence of people with disabilities, i.e., we're not quite sure how to do it ourselves. We don't know what to do, how to do it, and they're the experts. And we know that that's not true. And we also have to keep in mind that this model was started back in the 1960s, when we knew a lot less and there was a lot less accessibility out there. And there were little things like the internet and cell phones where we could all communicate with one another, not just nationally, but internationally, to work on things together. These didn't exist. So if this was all developed in a time that is so far behind us, it's time to change things now. So the DIC also draws parallels to things like the medical industrial complex or the military industrial complex, which maybe these are things that you've heard of if you weren't sure of what the disability industrial complex is. So medical industrial complex is an easy one to sort of explain, especially for Americans, if we think about it. So in the States, you've got your drug reps that get a lot of money from selling prescriptions. They sell them to doctors. They sell them to people. I'm sure right now, if I said, I've got a prize for the first person that can name me 10 medications sold in the States with this as a side effect, we could probably all list them off, because we hear it all the time on TV. So they get money to sell this to doctors and sell it to people. And then the doctors prescribe these medications, because if they prescribe enough of something, they get a reward from the medical company. And then the person takes it, but then they get a side effect. So then they have to go back to the hospital and pay more money to see a doctor, where they're going to be prescribed another pill, which is then going to give them another side effect, and so on and so on and so on. And we see this all the time. It's that complex. It just keeps going in a circular motion. We need to stop that circle and turn it backwards. Murielle.
So what about the charitable industrial complex? Have you ever been at a checkout counter at a major retail outlet, and you were asked, would you like to donate to X or X? Or have you ever wondered, where does that money go? How is it dispersed, etc.?
Right. One of the prime ones that I think of when I hear this was last summer in Nova Scotia. We had those terrible, terrible fires. And we saw one of the local organizations put on this big event to raise money to help people, fire victims. So they raised 1.3 million. I remember them talking about this. Then they took that money. So there were people that got paid to divvy up that money and send it out to different local groups that were going to do things. So the 1.3 million probably ended up being 1.1 million that was sent out to all these groups. Then all these groups kept a percentage of that money to run their studies, to run their programs, to see who needs what, who needs where, and blah, blah, blah. And so at the end, it started at 1.3 raised, but how much money actually made it into fire victims' hands. Based off a lot of stats that we see out there, it was probably about $700,000. And that's just not okay with me anymore. The more I think about it, the more I go, that's not cool. That's not okay.
And what about all those nice shiny posters we see?
Yes.
You know,
And the commercials on TV and the handouts that get sent. Like I think of Red Cross. I gave them $10 last year. I'm sure I've received $75 in mailouts from them in the last year. And I'm like, you've lost money off the $10 I sent you. And that's not okay.
so but why should I care? It has nothing to do with my life, or does it?
So these pieces, like, are you doing this one? I can't remember, hon.
You are.
Okay. So we looked at 6 top reasons that this really affects us. So one, it's fundamental human rights and societal justice, right? Whether it's the charitable industrial complex or the disability industrial complex, we're people and we deserve to be treated as such. It doesn't matter if our disability, really the very minor barriers in society that really don't play a role on us. My daughter has autism and she also has a low IQ, yet she's a member of the Canadian Army, going into the Navy. The barriers have not caused a lot of difficulties for her. Whereas I have just developed my disability in the last 5 years, but I'm now housebound because of it. So barriers are much bigger. It shouldn't matter where it is. It's a human right. We have the right to get what we need when we need it. By addressing, number 2, these barriers perpetuated by the disability industrial complex, we're going to create more inclusive societies, because it's automatically going to mean that people with disabilities have more control and more choice and more say over their needs. There is an exploitation of individuals with disabilities for profit or as a way to sustain these industries, and that's questionable. That's actually very, very ethically questionable. And we all need to stop and think about that. Number 4, breaking down barriers and creating more inclusive environments. We enable individuals with disabilities to participate more fully, and that has a great economic impact on communities. We all learned during COVID, for those that did not know, how devastating isolation can be. It's the first big snowfall here in Atlantic Canada of the year. And for most people that have any type of mobility disability or vision disability, it is now the start of the you're stuck at home for 6 months season, because sidewalks don't get cleared right and it's not safe. If there were more breaking down of these barriers and more advocacy for things that we really need, like clean sidewalks, people could go out and do more and be involved more and volunteer more and be parts of their community more. And that's huge, because it also eliminates the mental health difficulties that many of us face. Addressing the issues within the disability industrial complex can lead to better living conditions and improve well-being for everyone. And creating systems that empower people with disabilities benefits everyone. If barriers are removed, innovations in technology, design, accessibility emerge, and that benefits everyone, not just people with disabilities. As we always say, when our needs are met, everyone's needs are met. So, all right, that's all, the big teacher lingo. Sorry, I was a teacher before all this took place. So let's talk a little more concretely for those that like to learn that way. So one, don't tell, but there is a dirty little secret out there. And that's once government money starts flowing into not-for-profits or charitable groups that become a part of the disability industrial complex, it is really hard to break that cycle, because it becomes a part of how they survive and sustain. And this continues even if there's weak or no positive effects. And when we want to relate this back to New Brunswick, regulations were changed last year. And at first I thought it was a good thing, but now when I think about it, I go, oh, Shelley, what were you thinking? The groups have actually convinced the government that they only need to do a check-in once every 5 years. So if they have no positive effects or even all negative effects, they will continue to receive their funding, continue this cycle for 5 years before there could be any, we need to think about this. That's a problem. And Why doesn't it change when there is weak or no positive effects? Well, one, it's a long, well-entrenched old system, and that is hard to break. All right, it is really hard to break. And if you think about it, if the government starts pulling funding from a lot of these groups, they will be on social media talking about how they're going to have to close down and do this. And it's going to tug at heartstrings, and the government's going to get so much flack, the funding's going to go back. The only way we can do it is basically say, whoa, the old program, it's not working anymore, and we need to start new right from the get-go. Jan 1, a whole new system's going in place for everyone and everything. The other part is, especially in Canada, well, in the States as well, it runs through so many in Canada, federal, provincial, and even municipal sometimes. It's all tied together. And to even just follow the thread for anyone that's tried to get services, you know how confusing and complicated that could be. There's another author that I discovered in research called John McKnight. He writes about what's called the service system. And he talks about how, again, it was written on this narrative that people are incompetent. And again, they don't mean that we're not intelligent. It means that we were never given the opportunities to show our abilities, right? And that whole system was originally created back in the 50s and 60s and 70s under the narrative that people with disabilities are the problem and that the professional servicer is the answer. Well, any answers that are built on that type of system are never going to work to eliminate barriers because their ultimate goal is to keep employed. And you can't blame them in a way. If this has been set up and they've trained for this and this is what they want to do and that's what they're told, their job is to keep this going, that's what they're going to do. And, you know, we have to remember that there are some people with disabilities that no matter what will not be able to live a truly independent life because of the nature of their disabilities. But ultimately, we have to remember that they are still people. They are not a problem like the system sets it up with. They are not a number. They are people. In terms of the system, why are there not more accessibility tools being facilitated out there right now that would allow us more liberty and more independence? Why are we not seeing more universally designed homes so that by the time you get dressed in the morning, you haven't used up 8 of your 10 spoons and you could go work or you could go volunteer or you could at least go down to the coffee shop if that's what you wanted? And why are many of us across the spectrum being told that we don't get a choice on whether or not we can marry? If we want to get married, we have to give up benefits. These are things that need to be broken within this system right now. And after decades of a well-oiled system, changing that will be difficult. But again, we are experts at thinking outside the box and finding solutions. And it is going to be up to people with disabilities to find the solution to shut down the DIC and make it work the way we need it to work. And there are other groups, so there are other not-for-profits, advocacy groups, or parent groups that are like ours and that remain grassroots. We do not take a penny at the NBCPD from the government. We are all volunteers. We have people that donate things. We do a bingo once a year to raise a few funds, but it is completely we do it ourselves because we don't want to have to toe the government line. We want to be able to say what needs to be said when it needs to be said. And as soon as a group takes on a service role that has any type of payment back to the government, you get stuck in that cog, which is unfortunate because often great groups go into it with the best of intentions and then they get stuck in there. And then if you say what needs to be said, you're afraid of losing that funding and it becomes a problem. We need to expect better from these groups that are out there, these service providers, to help us. And we need to ensure that at all times they 100% represent the best interests of all children and all adults with disabilities. So we've been talking, and I want to zip through this because I want to hear from you guys. 2 quick questions to keep in mind whenever we're thinking of the DIC. 1, we all know, we all say this and we all do, and we say money, 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 money's going to fix everything. Yet millions, and in some cases billions, are spent within the DIC and we're not seeing results. And some people would say things are getting worse. Yeah. Here in New Brunswick, and here's something that's going to come out of my mouth that people that know me know, oh, she's never said that before. I agree with Premier Higgs on this one. He talked to us at a coffee chat about a year ago that we held, and we talked about, he didn't realize it was his DIC. It's not the word he used, but he talked about St. John. it's always been listed, we've seen as one of the country's most impoverished cities, which is ironic because there's so much wealth on the outskirts. We talk about how it has the highest teen pregnancy numbers, it has some of the highest obesity numbers, it has some of the highest homelessness numbers, some of the highest disability numbers. And he talked about how they'd done really increased spending in St. John with no results. And he said, so what's going on? Why are we not seeing improvement there? And he talked about targeted spending, and he's right. Because within the DIC, if you just hand money over to these groups to fix issues, the first thing they do is they go out and hire more staff. So we might give another $5 million to St. John, but how much of that actually ever went out to help the people who needed it? Or did a lot of it get spent to make offices bigger, hire more staff, maybe do a few, we got new staff, now we're going to have to do a retreat, and we're going to have to do this and go, there's been all kinds of multiple conferences I've seen people go to this year to Newfoundland and Halifax, and it's costing thousands and thousands of dollars, and that's all coming out of money that should be going to help people with disabilities. So that's the first question. Will money always fix this problem? Right? Is it money in general, or does it have to be very targeted, specific money? And two, are disability services a business? So we would all want to say no, it's not a business, but it is. It's a very big business. And we persons with disabilities become that raw material that fuels the growth. And we have to say, no more. I will not be what fuels your growth. I will be what fuels my own growth. And I will decide what is the best for me. And that's the way we can fix this problem. So I made up a new little place, and it's called Magasin Store because we're bilingual here in New Brunswick. So Magasin Store is a new store. It's a big store. It's taken over the country by storm. And their job is to always focus on adding new products, services, lowering prices, expanding their coverage area, increasing their customer base. And this is all done so that they can make more money and grow their business. And you know what? That is okay for consumerism. But it's not okay for how you provide services with me. I can choose to go to Magasin Store. I got to go out today. I need to get a new TV and some food. Well, TV's not a need, it's a want, but I want to buy one. So I've decided, okay, I'm going to go to Magasin Store. If I don't like the TVs they have, or they're not a good price, I can go elsewhere. I might decide to buy my TV at Magasin Store because they're having a really good sale, but go elsewhere for the food that I need, or buy some of my food here and some of my food elsewhere, because I have a choice. And if service is poor at Magasin Store, if they're not treating me well because I'm a person with a disability, or they're talking down to me, or they're talking down to my friend in a wheelchair and doing the now, there on the shoulder stuff, I'm going elsewhere. But that's the key. I have a choice. How many people can say they have that choice when it comes to disability services? Not many of us. In bigger cities, I'm assuming in Toronto, there's more choice than in New Brunswick. But here in New Brunswick, this is particularly true, that lack of consumer choice. And then it becomes even more limited because 40% of our population is in rural communities. There's even less offerings in rural than in the urban, although the new Municipalities Act says that is not supposed to be that way. And we can add another monkey wrench into that in New Brunswick because we are the only bilingual province in Canada. So if you are a francophone living in a predominantly Anglophone or English area and you want services in French, it's going to be hard. Now, if it's in a rural community, it's going to be next to impossible. So we have all these struggles that can really, really reduce any possibility of consumer choice. Consumer choice forces Magasin Store to do better, forces them to lower their prices, give better service, treat people better. There is nothing within the DIC that forces these service providers to do better. All they have to do is meet government regulations. They can fail us every day of the week and they still get their funding. And the more you think about this, I hope like me, you're going to start to go, whoa, this isn't right. Whether you're the service provider, because there's still a job for the service provider. Just you're going to do better outside the DIC, and you're going to have more control over what you offer and what you do, or you're the person with the disability. I mean, think about it. How many businesses with a 50 to 75% fail rate get to survive out there? None, unless they're a service provider that is protected by the disability industrial complex. And this is why we have a wait list of housing up to 10,000 names, because everyone was okay with saying, oh, we'll close the MB Housing Corporation and we'll give it out to not-for-profits to keep an eye on it. And we'll let it be market dominated, market run. And then all of a sudden, we now have people freezing to death in tents. Not cool. There's no public housing left. And now the government just made an announcement this past week. Out of the 33 million that was supposed to be spent on public housing for next week, they're spending 4 million. Oh, just a little bit short, just a little bit. You know, that's a lot of people. The 380 units that they've committed to over the next 5 years, that's not even enough. Just like scratch the dent in a place like Puckmush, let alone in Moncton. Like, it's not enough. We need more. If you want to apply for disability services or social development services, you're often pushed to go through one of these third-party service providers. You don't need to. You can go right onto the social assistance site, onto the social development site. But people are encouraged to go out to these people and do it this way. And that takes up time, jobs, money that could be spent directly for us. Too often we know that these third-party service providers are run by able-bodied people or people with disabilities, but their disability is not intensive enough, or it's not progressive enough that barriers in society really stop them. If you can go out and work every day and enjoy life outside of that, you know, you may have a bit of a disability like my daughter with the autism, but there's not enough barriers out there to stop her. Whereas if I step outside my front door, I can die. That's a pretty big barrier, right? We have some of them, they're in non-accessible buildings. Can you imagine? Hi, I'm company ABZ. We offer disability services. Oh, you're in a wheelchair? You can't get in. Really? They're not on bus routes. I don't know how many of you out there can buy a car when you get $860 a month, but most of us can't. So we need those bus routes. Again, little things that are not being thought of. If the staff don't have a disability or a disability that is impairing them from moving forward, and that means that no matter how hard they try, matter how hard they want to empathize, they can't 100% get it. And I can say that as a teacher who did all kinds of work with my students out there to try and do better for the collective good, to try and do good works in the community. And I thought we were doing some good things for the disability community. And I realize now how badly our work sucked the big one. And I can also say, as a mom of a daughter with autism, before my disability took over my life, that I thought I could empathize and understand what she's going through. And again, her barriers weren't massive. And it's completely different once you have that disability. So these are all things that make it difficult to break, but it's not impossible. And like I've said over and over, we are the people that know how to think outside the box. We are the people that know how to make changes and change this stuff. So we can do this. And I could go through all this. I'm just leaving these in here. We're not going to talk about them. You don't need to be talking about this stuff. These are just some of the stats from Canada about how bad things are. You know, that 91% of people say it's unacceptable that we're underemployed, because we are the most underemployed workforce out there. We know that. People say that, they need to follow through on it. We know that there's huge numbers of people that face exclusion and inequality because of their disabilities. This can't continue. We know that New Brunswick just saw its disability rates go up by 8.6%. Unacceptable. So I'm going to escape out of this, hopefully do it right this time without blocking myself out. I'm going to say, stop this. And hopefully do it right this time. Oh, I think I did. And I'm going to ask you guys, I'm going to ask if people want to either in the chat or unmute themselves. And I want you to tell us, like, think about this now that we've talked about it, like this concept of the DIC, the Disability Industrial Complex. The DIC, but not the big dick, is what we call it, the DIC. Do you see it in your region? Can you think about that now, if you didn't know what it was, and say, Yeah, I can see that now. And can you give us an example? You don't necessarily have to call it out. Like I see Colette talked about the caregiver fund. I think that's an excellent example where independent disabled Canadians who don't have family are left out of the funding for caregivers that we need to hire because we don't have a family. Yeah. And or they've got a new one for caregiving with, especially with children. But if your children had this disability before they pass a regulation, you don't qualify. So can you think of some examples that are part of the DIC and share them with us? Because this is about how we can make changes when we talk about it as a group. So I don't know if anyone wants to unmute or ask to share or just wants to write it in here, but that, this is how we make change happen.
Yeah, thank you, Shelley. So if you were wanting to, oh yeah, I have Mark here.
Yes, Mark, good, because I was just reading his comments. They're amazing. And Colette.
Yeah, Colette is here. Mark.
Hi.
Can you hear me?
Mark.
About some of the issues that I faced as a disabled Canadian and how the basically industrial complex for disabled people has affected my life, specifically as a disabled parent. Ontario Social Assistance is all tied in together with ODSP and Children's Aid Society.
Mm-hmm.
And I have faced investigations because of poverty. And I have been taken to court because of poverty. And it has caused immense trauma to my family. And rather than being provided a livable income, rather than being provided the resources that I need, I am faced with losing my children, given to someone else that has the resources and someone else that has the funding. Because they fund foster homes more than they fund people to keep our children in our own spaces.
Absolutely. It's terrible. And
for myself, our family also has celiac disease. So we can't use the food bank. Mm-hmm. The last time that I used the food bank, the vegetables I received were literally sitting in their own rotting juices. And almost everything had gluten in it. And I had a complete mental breakdown because of it. How can an organization say that they have helped someone, that they have fed someone, and given them things that they can't actually eat? Mm-hmm. And so therefore, I'm still in poverty. I'm still struggling to feed my family. And oftentimes, I find myself cutting back on food to make sure my kids have enough. And I shouldn't be doing that because I am trying to get ready for a double mastectomy and a hysterectomy because I am also a genetic cancer patient. And I know that I will not survive if I am suffering from malnutrition. And people's disabilities are becoming worse because we are not provided the nutritional needs we need, let alone enough for housing costs. As I mentioned in the chat, my rent is over $1,300 plus utilities, but I only receive $875 for shelter. And while I have been very lucky to get on the Housing Retention Fund, it has an expiration date of 2028. And that is an axe that looms over my head of when I will become homeless with my child, who is also autistic. And the way that our system works is if my child is able and capable of retaining employment, 50% of her income will be deducted off of my check as the disabled person. So we can't even keep our children at home with us without penalty.
Yep, it's gross. The neighbor across the street from me is a foster parent, and she's same thing. She takes in these children that are the parents are being forced to give up because children's it's social development here. They sometimes take your children. I don't think it's as bad. I've heard horror stories out of Ontario, but they encourage people to forego parental rights and give their children back to the state when their care is excessive. She gets 22 paid vacation days a year as a foster parent. I've got parents that can't get 2 hours a week of respite care covered. Like, it's ridiculous the way we are treated, like we have done something wrong or we're criminals. And I'm so sorry you're going through this, Colette, because it's so wrong. It's so wrong.
Thank you.
I had one person suggest that we almost need to make some sort of proposal to the federal government and have it emanate down from one source so that it's universal, because we should be then also be able to move province to province for services and not have to start over. And the provinces have to pay up to the feds for services, for some of these services. I don't know what the answer is, but this has become near and dear to my heart. And this is going to become one of my big sticking points for the next few years to really fight for. We've got to find a way around this because we deserve better. This is Canada. This is Canada, and people deserve better. And we are the people that can fix this country, because our entire lives we've had to think outside the box. We have the creativity and the knowledge and the know-how to make our country work again. And we're not going to be silent. One of the good things that came from the pandemic is I think people with disabilities from coast to coast to coast came together, and we got mad and we said, no more, no more. And my oldest daughter is a bit of a radical, and she keeps going, I'm so proud of you, Mom. I'm so proud of you. You're becoming a rabble rouser. And I love it. And it's given me something to live for as someone that can't leave my house. I was ready to use MAID. I was all set. And not now. This will keep me living just to fight this and see this system change. And it's worth every second. So, and Mark, I see you've got some great stuff here. Yes, go ahead.
You made me a rouser while I was in the chat, because I'm pretty frustrated as well. And I'm just so happy that you're getting real. Like, I like how you're saying, it's not necessarily their fault because they're bad, or it's just the system. And my comment has to do with the service providing system where it's perpetuating itself. And when we were going through it, there's this weird experience that you have, and you just said it now, it's like you feel like you're a criminal, like you feel like you're being placated to death. If you ask a question, you're like, wow, there's no space for you. Yeah. And I feel like it's so extreme now that it's really not doing what it's there to do. One example is we ended up escalating all the way to the very top, to the Alberta Ombudsman, trying to figure out, like, why are these people not doing their jobs properly? And even the Alberta Ombudsman, which gets paid $9.3 million per year, has these little tricks where they don't have to actually investigate anything seriously. So What ends up happening is when you're not being treated properly, especially on disability, where you're already vulnerable and you're already stereotyped, you're stuck in this infinite loop that you can't get out of. Yet we're spending millions of dollars to keep people stirring. And I thought, when we were mapping this all out, there's 26 offices and there's like 7 different levels you have to go through. And we found out after a while, the offices are actually there to deter you from going forward, because as long as you don't get any answers to your questions, you're powerless. So we thought, wow, whether you're a guardian or you're the client, as long as the person who's supposed to protect you has no power, you can't get any services. And so we thought, well, a very simple, we need a foundational reset. It's not, if we pack another office on top of all this mess, we're just causing more problems.
Oh yeah, we got to rip the whole old system out and start fresh.
Yeah. And I feel like, what would really be a simple, powerful intervention is if really, instead of having cases and all this weird stuff that's easy to pass off to another office, whatever, we made it so that when you ask a question, every question you ask that's a serious question gets a ticket number. And the whole advocacy system is built on that question. And if that question doesn't get voted on you as an 8 out of 10 or better answer, then there's something that's probably harming you with that, or there's some kind of blind spot in the system that hasn't been identified, and we need to start a new committee to identify that. And then the committee is relevant, and it's not self-perpetuating. It dissolves as soon as the question is answered.
Yep.
I feel like such a simple thing is so powerful.
Yeah.
And it's funny because even
No, go
even
ahead.
with the John Humphrey Center, Renee said that knowledge is the true empowerment. And I feel like this would be, empowerment by education at the same time. Mm-hmm. So, okay, I just wanted to lay that idea out there.
No, I think that's really interesting, because a lot of times the issue relates to they don't quite know what I'm helping a mom right now who's got a young boy with Dravet syndrome. He's one of 5 in New Brunswick. They keep saying, well, it's just epilepsy. No, it's not. it's so much more advanced. And I mean, the things that they have done, they've taken her son away for a year and a half. And she's got him back. They've done so many. They tried to take him for a surgery where he was going to end up having, because he's got a hip dysphasia, and they were going to work. But the thing is, the doctors that deal with him, they're specialists, said, no, the trauma of the surgery is not worth it. He's getting close to his life expectancy anyways. That was to put him in a wheelchair so he couldn't run anymore. This is what one of the 2 respite homes in our province was going to do to this child. This mom has had it, and she's now filed, and she has 9 human rights cases going out against the government, and they're moving to the next stage. And that's the thing, we need to get vocal. I'm going to find you in the thing after, Mark, and make contact, because I think that's a really good idea. Or if you our email is just
I'm filling out a meeting request with you now.
Yeah.
I would love to.
Oh, good, you got it. All right, perfect.
Yeah, I got it, but I'm not sure of our schedule right now.
Yes, but we'll work it out. Yeah,
It
I
wouldn't
think that's
be for
great.
Monday, right?
I'll put my email in the chat too, just in
Okay,
case.
perfect. Yeah.
And I suppose too, in terms of like going around the province and getting our voices heard, we found that even if you get groups of people together, you're still powerless. It has to be legal. So we had these questions lead to class action lawsuits, then it would automatically get people together to sue, to have the money to actually start a real policy investigation. And then they're not just treating us as complainers, right? We're actually creating solutions that are well researched. So, okay, I will definitely be in touch with you guys.
And they scare you that you're afraid you're going to lose what little bit of assistance you get. So that's why I feel safe to rabble rouse, because I was on assistance for 11 months waiting, and the poverty was unreal, because I was a teacher making almost $90,000 a year. I died in front of my students. I have what's called chemical sensitivity, and it's so severe. Now I know what it is, and that I had it for 10 years, but building up, it was manageable. And then all of a sudden, this one day, it just got me. And I died in front of my students, and they're grade 6, my homeroom, grade 6. I traumatized some of those kids, and I still am on myself about that all the time. It wasn't my fault, but it bothers me, because I know I hurt some of them, and that's not why you go into teaching. And I get so mad at the system, because I had to fight for 11 months just to get coverage finally approved. I was told by WorkSafe, which is our workers' comp, that I had histrionics, crazy woman syndrome. That's what they told me. You know, I was just fortunate. I got into the one specialist in Atlantic Canada that deals with it. And now I get my CPPD. I lucked out. I get that, and I get my long-term disability, because they screwed it up so badly, and one was approved before the other. So I actually get to keep both. So I'm making almost what I was making teaching. So I can rabble rouse, because one, I volunteer, I donate the Zoom for our organization. I can pay for a few things because I can afford it. And secondly, the government can't hold it over my head, because I don't get a penny from them. And I want to make sure that life gets better for people, especially with, just getting sidewalks clean so people with wheelchairs can go out in the winter. Like, come on, how hard is that? You
Don't
should
get
be
me going again.
home because you're in a wheelchair all winter long, right? Like, it's crazy. So
there's another message.
Yeah, I see from Karen. She wrote, because she's a member of our coalition, but she put in 2006 she took part in a roundtable on poverty in New Brunswick with 27 local charities, and these charities, they're just duplicating services. Yippers, duplicate. Resources were not being utilized effectively. It has not changed, and it's like, how much of that money that the government says goes towards helping people with disabilities is actually going into a pot to keep people employed.
I didn't see that message. It's funny. I don't seem to be seeing the same.
Mine's are in the chat here. But
yeah, you need to go to the session chat, Murielle. Like click on session, then chat.
And yes, Colette says we need Derb. We
session. I was in event.
Oh.
Okay, event. I was
Yeah.
in event chats.
So Colette also put on here that we need a DERB to hold us over from the federal government. Yeah.
Yep.
I even would say I think we should be pushing our provincial governments right now because they're the ones that pooched it so bad that the feds are stepping in and they're going to put through the Canadian Disability Benefit. We've got a year to go, and I know that's a very long year for a lot of people, and for people with children with or even adults with very expense. Some disabilities are way more expensive to care for, like people that do have celiac disease. Just your food costs. In New Brunswick, they give you a whopping $40 for that. What's that going to get you? One loaf of gluten-free bread? That's about it, right? So they have to be more realistic on the numbers and what it costs for care. I know of a parent in Ontario who's got a child with multiple complex disabilities. They just cut her nursing care in half. This child's going to die because of this. It's not acceptable. Not acceptable, and it's disgusting. So I don't know, but anyways, our time is almost up. So I just wanted to finish with a quick call to action. And the biggest thing to do is if you were someone that said, "Oh, I'm not sure what the disability industrial complex is prior to this," or you did. Either way, and you're going like us, going, okay, things have to change. Write your government, write your provincial leaders or your territorial leaders, or if you're elsewhere, your state government, write your ministers dealing with disabilities, with housing, all this, and say, this is ridiculous. And you're spending so much money, duplicating services, wasting money, when money could be more targeted and spent in a proper way that would make real significant changes in society, and give them flat out examples. Give them the example, because they don't understand, I think, sometimes, unless we point it out in black and white to them, say, like, here's a prime example. There are 6 groups in my city that do this, but not one of them does it right. And just show them that, because I don't think they know, or if they know, they don't care enough to understand. And we just need to keep shaming them until they do, and reminding them, as Mr. Lepofsky says, there are 2 types of people in this world: people with disabilities and people with disabilities in waiting. We're all going to be there someday as we age. Let's make society better now, because waiting till it's an issue for you is way too late. Way too late. And if anybody wants to reach out to us, we have a website. It's NBCPD, so New Brunswick, C for Coalition, P for Persons, D, disabilities.org. Our email is info@nbcpd.org. And we would love to. Murielle just put it in the chat. Thank you, Murielle. The best way to fix this is we set up a group across the country, and we're all going at Kamal Harris and saying, like, come on, voyons donc. This is not right. And this, you guys have to do better. You're not meeting up to your commitments to the United Nations rights of persons with disabilities. You're not meeting these basic needs. And all that's going to happen is, when you don't meet the need today, you meet it in a couple of years' time in the hospital, and it's way more expensive. So there's so much that can be changed today, and we're the people that can lead that change, because it's our lives, and they need to listen to us, and they're starting to. So it's time to. And I want to thank you all for coming today. With this, we'll let you go. It's about time to start the next session anyhow. But thank you, and it's been amazing, and we're so glad we get to share this and hear from some of you folks. So thank you very much.
And thank you
so much, Shelley and Murielle. Like, it was amazing. I have so much information now. I don't know if anybody has any questions. I have a question though.
Go ahead.
So you mentioned that more money isn't really doing anything. So how exactly can we donate? And like, how? I mean, I do a lot of volunteer work, but I also try to donate as well. So how do I make sure that my money is really going into good purpose and not half of it is going into administrative work?
Yeah. So what I do, that's an excellent question. So I know, like, I used to be the one at the cash register. They said, you want to share it? And I would give it. Now I make sure. So like for the food bank, We have a place here in Fredericton called Greener Village. Not only do they help with food, but they do some cooking classes and nutrition classes, and they have special things for people with gluten allergies. I give my money directly to them, because if I give it to another organization that then hands out, a chunk of it gets lost along the way. I don't give to large corporations because they then get all the PR for it. They get a tax break from it, and we don't know how much is being lost. So if it's for women's cancer and someone's raising money to buy a wig to help a woman, I'll give to that. Or for the lung associate, I give directly to people or help people directly out, because I think it works better. We've put up some of those, take one, give one, take some if you need, if you don't. One of our members, Karen, is going to teach me how to knit socks, because I'm starting to learn how to knit, and I'm going to make socks to help donate, because there's nothing worse than having cold, wet feet in the winter, right? So little things like that, I think, are better. I mean, we're still going to see people giving to these large groups, but you can question them.
Mm-hmm.
Question it. And like I've called up groups that send up so much crap to me and say, what are you doing?
And this new trend about give us your car.
No.
There are a lot of people out there, if you look a little bit, that really could benefit from your car.
Yeah.
And not like,
not a disability group. Yeah.
That's all I will say.
So, and there is a group called I believe it's called Charity Village. I forget. If you Google it, they do an inspection yearly on charities, and will let you know what percentage actually goes out and what stays with staff. But when I look at Little New Brunswick, and I know that there are disability groups where the chairperson or the CEO is getting almost $100,000 a year, that's too much money. That's way too much money for working in New Brunswick at one of these jobs when our members are starving to death right now. Not cool.
Yeah. Karen put it in the chat, charityvillage.com. So there's a link there for anyone who's interested. Thank you so much, Shelley and Murielle. Really appreciate you coming here, talking to us, giving us lots of educational information, giving us lots of things to think about as well. Like, I'm like thinking about like, okay, how can I help? I need to think outside the box, obviously. And I love the fact that you mentioned how we really need to ask for the needs of the people in need, and not really just someone somewhere just figuring out, I think you guys need this. You need to go to those who are in need, and then you can start work from there. So thank you very much for this session. You want to say something, Shelley? Sorry.
I just want to say thank you so much for hosting this. This is amazing. And I've learned so much at these sessions myself already, and traveling around. This has been so cool. So this is awesome.
Awesome.